From the campus of Penn State Health, Milton S. Hershey Medical Center, welcome to another edition of Ask Us Anything About. I'm Scott Gilbert. Today we want to talk about those pill bottles in your medicine cabinet. How many of those are for current active prescriptions, and how many might be left over from a few months, a year, even 5 or more years ago? Well, we want to talk about a special event happening this weekend on the Hershey Medical Center campus. This Saturday from 10 until 2, there will be a prescription drug take-back event happening here where you can bring old, unused, unneeded, unwanted prescription drugs, as well as needles and syringes to have them properly disposed of. It's a no questions asked event, so you bring them, drop them off anonymously, and they'll be taken care of. Here to talk more with me about that event and the reasons for it are Kimberly Cimarelli. She's inpatient pharmacy manager here at the Medical Center, as well as Officer Rebecca Kessler with the Derry Township Police Department. Thanks for being here today, both of you.
Thank you for having us.
Let's talk a little bit about expired prescription drugs and why it's just not a good idea to have them around, starting with the fact that, really, they're not of use after a certain amount of time, right, Kimmy?
Yes, the efficacy of the drugs they won't be effective, and so we really need to make sure that they're disposed of properly, because we want patients to actually take medications that they need to, not ones that are expired.
And it also runs the risk of having people like children come across them accidentally.
Yes, medications look like candy to children, so we want to make sure that they are out of the medicine cabinet and in a proper disposal, like some type of, like what the Derry Township Police has or what we are doing this weekend.
And sometimes people may come across those medications, Officer Kessler, and maybe not so accidentally take them.
Right. Unfortunately, there's a high level of abuse now of prescription meds, and if they can't come across the meds legally, then they'll start to take them from other people's medicine cabinets, and so it invites crime by leaving it behind.
There's new numbers from the DEA that show that those numbers are indeed on the rise. Another temptation that could come is, what's wrong with if I say, well, I took that medication for that illness 6 months ago back when I had it. What do you know? I have the same infection again. I can just take the same drug again. I'll just self-medicate.
Well, one, do you really know if that's the same infection that you have right now? And does that medication treat that specific illness that you have? And plus, drugs have become resistant after a while. So if you start taking a medication that you don't know what it's for, or because it treated something in the past, it may not treat something in the future because of resistance.
You're watching Ask Us Anything About from the campus of Hershey Medical Center. I'm Scott Gilbert alongside Kimberly Cimarelli, also Officer Rebecca Kessler. We're talking about the prescription drug take-back event that will happen this Saturday between 10 a.m. and 2 p.m. here at the Academic Support Building. The mailing address is 90 Hope Drive, Hershey, PA 17033. So if you plug that into your GPS, it will get you here to the parking lot. And we're going to talk a little bit about that event and kind of the format we'll take very shortly here. But I'd also like to talk about the other ways that people sometimes get rid of prescription drugs apart from events like this. It could involve flushing them down the toilet, out of sight, out of mind. Any problem with that?
Yes, that gets into the water system and could be harmful to the community. So we want to make sure that it is disposed of properly. And we have what we're doing this weekend. It will be incinerated, and it goes right to the DEA and then becomes incinerated. Now,
what if I throw those medications in the trash and the garbage? Is that a good idea?
Well, if you throw it in the trash, then it ends up in our landfills and ends up in the soil system. And we want to obviously keep it out of our water systems as well.
Now, as I mentioned earlier, we are also accepting needles and syringes at this Saturday's event here on the Hershey Medical Center campus. So I'd like to shift gears to that and talk a little bit about, if you could, Kimmy, the wide range of patients who might have a need for getting rid of those kinds of materials.
So we have, you could have insulin needles for diabetic patients. There can be anticoagulation medications that are out there that can be injectable. And also hospice patients, there is a lot of medications associated that are injectables that you want to throw away, needles and syringes properly. Like I said before, it could be anywhere up to $250 to dispose of them properly. So we are doing this as a service to our community and to our patients to make sure that we get rid of them properly.
And again, putting these in the trash, also a bad idea, but for a different reason, right?
Oh, absolutely. You don't want your trash collectors or anybody else that might handle the trash to get stuck by the needle, especially if somebody has a virus or there's an illegal drug still remaining behind in that syringe, because obviously the other people probably don't want to receive that. And also, you just want to make sure to take care of everybody, and you don't want somebody to be tempted that doesn't have access to a clean needle to go and reuse that dirty needle.
Well, as you watch Ask Us Anything About here from the campus of Hershey Medical Center, we welcome your questions. Feel free to add them to the comment field of this Facebook post, and we can pose them to the experts here. Or even after, if you're watching this video on playback after the fact and not live, we can still get those questions to these folks, and we'll post those answers as a comment as well. So, and again, I'm talking with Kimberly Cimarelli, the inpatient pharmacy manager here at the Medical Center, as well as Officer Rebecca Kessler with the Derry Township Police Department. And this Saturday's event from 10 a.m. to 2 p.m. here on the campus of the Medical Center at the Academic Support Building. Also, just a quick reminder that if you follow us on Facebook, click on that follow button on the Penn State Milton S. Hershey Medical Center Facebook page. You can follow us and get notifications about similar interviews just like this in the future. You know, we're talking about syringe and needle disposal. Some people keep those in an old laundry detergent container, and that can be safe, correct?
It can be. You want to have something that's hard plastic, something that the needle can't get through, because again, you don't want anybody to be stuck with that needle or in the future.
So needles, syringes, unused, unwanted prescription medication, all welcome this Saturday at the event.
Yes.
Tell me a little bit about how that event will work this weekend.
So it's a drive-through event. We will have cars pull up. We have a handout about medication safety. That's the first stop that they'll make. And then there's 2 stops for either medications to be disposed of, and then the next stop is for needles and syringes to be disposed of.
And Officer Kessler, one concern some people may have is, well, my pill bottles have my name and personal information on them. Is it necessary to remove those labels before coming to the event?
They don't have to. What happens is once they drop the medications into the box, once that box gets full, I seal that box shut, and then it gets transported to the DEA's office in Harrisburg, and then the DEA takes care of incinerating everything, so that bottle should never see the light of day again.
And this is a drive-through event happening this
Yes.
weekend, right?
Mm-hmm.
What does that mean? Literally just stay in your car, drop them, and go.
Stay in your car, make the necessary stops that you have to, and then you're on your way out the door.
It's completely anonymous, completely free.
Mm-hmm.
Okay, fantastic. And again, that's happening here at the Academic Support Building. The mailing address is 90 Hope Drive. It's here on the campus of Penn State Health Milton S. Hershey Medical Center in Hershey. Any closing comments from either of you as we bring this edition of Ask Us Anything About to a close?
No, we hope to see you at the event, and we want to stress that this is one of the only locations taking care of disposing of properly needles and syringes.
Pretty much what she just said.
Fantastic. Thanks to both of you for being here today, and thanks for having this event on Saturday. The other thing I do want to mention, kind of as a postscript here, is that the Derry Township Police Department is one of many that has a drop-off location where you can drop prescription medication off 24/7, right?
Yes, and our station's located at 620 Clearwater Road in Hershey, and it's a 24-hour, 7-day-a-week lobby, so you can go in anytime, 3 o'clock in the morning if you want, to dispose of those meds. There's only certain limitations that are posted on that box, mainly no liquids, no needles, and I believe it's no aerosols are allowed in that box.
Okay, great. Thanks again to you both for being here today, and we hope to see you this Saturday here on the campus of the Medical Center for this event, this drug take-back event at 90 Hope Drive, Hershey, PA. That's where you type into your GPS and it will get you here. Thanks a lot for tuning in to this edition of Ask Us Anything About from Penn State Health, Milton S. Hershey Medical Center.